Now we're going to see the wound complications in the postoperative period. We have wound infection, dehiscence, evisceration, and fistula. Fistula, we will talk about this on a separate video. We will talk here about infection, dehiscence, and evisceration. So, the patient with a wound infection, you know, it could be just the cellulitis or the abscess. Abscess is the same as pus formation and is the same as fluctuant tissue. So you feel it and it would feel like fluctuant. If you have doubt, you need to do a sonogram to see if you can see the abscess. And remember that this most commonly occurs in the postoperative day 7, and certainly the abscess needs to be treated with surgical drainage, and if just the cellulitis, just with antibiotics. So now in the dehiscence, the patient has a usually on the abdominal surgeries or things like that, we closure the fascia, and the dehiscence is when this closure of the fascia is opening. This presents as maybe the wound looks intact, so on the skin it looks intact, but it is, the fascia, the one that is disrupted, so there could be peritoneal leakage through that fascial closure. The patient can have peritonitis as a complication, so we need to be very careful with this. The patient will present with the sock of the blanket with a salmon color. So it is like very massive fluid that is being drained. If the patient can tolerate, we need to take it to the operating room and reclosure that. If the patient has a high risk of surgery, then we can try with just abdomen binders or things like that. Caution with mobilization and cough, etc. The dehiscence usually occurs when the patient is getting out of bed, straining, coughing, sneezing, doing effort, basal maneuver, things like that. And the evisceration is a complication of the dehiscence. Evisceration is when the abdominal content goes out. Here, this is very frightening for the patients. They can become, unconscious because they are seeing that. Here, we certainly need to take you to the operating room as an emergency, but first we need to cover the abdominal viscera with blankets, sterile blankets, wet on a warm saline solution. And so, most of the complications on the wound need to be treated with surgical procedures. Now, in the next video, we'll talk about the fistula formation.